to you once again in this video series from my kitchen here in Washington, D.C., and joined by the great Agnes Binagwaho, who is, I think, at her home in Kigali in Rwanda. Is that where you're at? Is that where you are, Agnes?
Yes, I'm in my home in Kigali, Rwanda, in the beautiful country of the 1,000 Hill. I feel safe because this country have taken the right measure at the right time and in the right way. And I hope all the world will be safe soon.
Yeah, well, I want to talk more about what the country has done and what you see unfolding in Africa. Just a word about you. First of all, I was there in Kigali just a year ago now, and I got to visit the place where you work principally these days. You wear many hats. People know you well as the former Minister of Health of Rwanda. You also are now the Vice Chancellor of the University for Global Health Equity, which is based in Butaro, which is a good 3 or 4 hour drive outside of Kigali in the countryside through those beautiful 1,000 hills, where you're working to train the next generation of public health and global health leaders. You sit on many boards, you're a lecturer at Harvard, you do lots of things. And so we're really eager to get your take, but maybe we can just start with what you said. What is the situation in Rwanda? I see pretty low numbers. I think it's 130 something people officially who have contracted the virus in the country. I think 0 deaths officially. What's the situation like where you are?
So first of all, we have to put that in the framework of the how the pandemic spread. Africa was tackled later, first of all, because there is less international travel than in Europe and in the US. And secondly, in Rwanda, we have, when we heard that it was a big outbreak in China, as soon as it was named a pandemic, we stopped the plane. We had a plane going to China. We stopped it. We asked our students if they want to come back or if they are safe where they are in China. We had communication with the leadership in China to make sure that they will always have what they need. During the shutdown China was going through. And we start checking the temperature of any person coming out of a plane, landing in Rwanda, and asking their phone, their references, where to contact them in case we have a sign. All the people with temperature was checked. And also all their contact in the plane, meaning you are sitting where, near who, etc. So this starts mid-January. So in the 14th
mid-January, you began all of that. Wow, that's very early compared to other countries.
But that's how any country should have done, because any country was alert. We didn't invent the information coming out from China. We just receive it like any country, any Ministry of Health, any government, any institute that is in charge to protect their population against any potential pandemic, and we have acted accordingly. When we say we, it's the government of Rwanda, of course, and the institution, Rwanda Biomedical Center, in charge. And all of us, as in the health sector, at the education, at the service delivery side, we propose our help. Because, of course, checking each and every one coming from a plane in Rwanda, it needs more personnel. So the country, the institution give some volunteers to go and help during 4 to 8 hours over the weekend, so that the people employed by the Ministry of Health can rest. So it was a collective effort starting in January. Now we had the first case in the 14th of March. What we did immediately, the same evening, the country was locked out. No more travel inside the country without necessity, inside your city without necessity. You also, all the people who were in contact were traced, tested. All the positive, we had a hospital dedicated to that, were there, well fed, well surrounded, etc. And the people who were contact very close in a hotel that were there for that, for free. We knew that a lockdown for a country with more than 40% of poor people will not last if people are not cared of. So we raised money for people to be fed. And the logistics was organized by the government. using the pyramid of local government that hand to the head of village. And head of village have to give, those are people that are vulnerable and need food, etc. So, and as an example, all leaders in Rwanda, public leaders, give 1 month of their salary, April salary, for this, for helping the vulnerable to have food. Doing so, no more churches, no more school, across the country, you apply social distancing that avoid the people who are infected to spread it. And that's what we did. But the day we knew the first case, and that's how now we had a total of 130 people infected. Among them were 80 people that came infected in Rwanda. And among the 136, 54 recover already at home. No people died. So this, we didn't did it because we are rich. No, we did it because we are organized. This, we didn't did it by with contests in the road and people say, it's my right to go anywhere. No, we did it because this solidarity approach and trust between communities has been built over years. And that's it.
Agnes, let me ask you a few things about that. One is, how long, given that you, as you said, this is a country where maybe half the country lives in extreme poverty, and people are working in the informal sector, they don't have savings, they need to go out of their house to get food. How long can you maintain that lockdown? And are you getting international support yet? And what do you want to see in terms of international support to help countries like Rwanda maintain the stay-at-home orders?
Oh, yes, we had international support. We will have international support like all the country in the world have. You know, Europe has, the European Bank has free money for the countries to help their own business and supposed to help the vulnerable. Here, we had the debt relief from IMF, and we have some partners who are supporting that. But we also know that individual Rwandans who are better off can do something for those who are not well off. And if we don't do that, in any case, it's also helping us and our own family to make all Rwandan safe and respecting the social distancing, because it will stop the spread and it will allow people to recover more quickly, the hospital and health sector to not be overloaded, so that when other people are sick with cancer or have to deliver or have other things, they will not die. And this can happen to everybody. And if we don't do that, we just make the country dysfunctional. So this was talked about before with churches, with private sector, with the media, with the people transporter, because imagine the taxi, the people with motor taxi who live every day with the income of the day. They need to be informed before the problem, how it will be managed for them to survive. So all this was ready. Is like you prepare for a war. The enemy was the virus. It was a guerrilla because this enemy is going everywhere, all over the country. And if we don't do that, prepare for a war, don't expect to win the war. Or you have
I think we could compare that with other countries, maybe very unfavorably. Not every country has acted as quickly or as determined a way. One of the things I've heard from global health leaders is that in some ways, Africa is in a better position because of all the experience dealing with infectious diseases, dealing with HIV, that you've got better contact tracing, better systems for testing, that you've got more of the community-based health approach than maybe even more advanced economies have. How do you see Africa's preparedness beyond Rwanda for this crisis?
I'm going to be very ironic in that, because you know all the white saviors are pretending coming from the Western world, who has messed up the management of this, except a few countries. And I don't say that Africa is a hub of good management. I just say that there are some countries, and not only Rwanda who are doing well because they have a people-centered reaction. It's not like in some countries, and you can see that. How come that in the US, 73% in some states of people who die are Black, when they do only a quarter of that population? This is absolutely insane. And that means the reaction is, and the preparation is not human-centered. And this is why I'm so proud of running an university that has put social justice in the practice of each and every clinician we are going we are educating. Because
it's even in the name of the university.
If you don't tackle, the university is called the University of Global Health Equity. And I used to say, forgot everything, but keep the word equity. Because everything you do needs to be done with an equity agenda. If you don't do that, when there is a mess like the world is now, don't count on the poor people to protect the society by going and die home, malnourished and sick from something else. No, they sacrifice enough all the other days. So that day, because they don't want to respect the lockdown, you will be in danger. So that means you need to care about them all along their life and show compassion and organization that take them in account. That day, when you need them, they will be there. Because also in Rwanda, people are at home, respect that, because they know that if they don't have food, food will bring to them. And we are all working on that. So
let me ask you, how do you see this evolving in Rwanda, in the region as well? I mean, as you mentioned, you've got countries with weak health systems. Rwanda may have a strong one, relatively speaking, but you've got neighboring countries maybe with weak health systems. And this virus seems to be highly contagious, highly transmissible. How do you expect to see this progress? What's your view on it in terms of what you're expecting?
The progress, I get you, Raj. The progress will be bad for countries that are not organized. Because I want to tell you now that the health sector is the lead organizer, but the answer, the head of all the response is the Prime Minister. Security organs are in the response because tracing, moving, protecting, taking temperature of people who have to walk in the road is not done by health sector, it's done by the police and the army. When we need the police and the army, you have seen New York have mobilized them, but we mobilized them before the catastrophe. We don't have to wait to be overloaded and people to die massively to organize things. It's too late. So, and this is a lesson for the next outbreak, because we will have many other outbreaks because of climate change. You know that all this ice that is melting in the north, free bacteria and other things that have survived in the ice that we don't know, we are not human with. We are wiped out of the surface of the earth forest with germ and virus there that we don't know because humans were not really going there. So if countries doesn't take the lesson of this COVID-19, what should be done in between two outbreaks? What should be done at the first case? We will face even worse than what we are facing now. So this is valid for Africa, and a strong health system in such a situation. I don't have a health, my country doesn't have a health sector stronger than the US. So the answer is out of the health sector. Health sector come when the person needed is a little bit late.
Yeah, I mean, so far you're right. The main tool in the world has been a behavioral tool. It's been social distancing, nothing really to do with the health system, staying home. But maybe in the future phases, testing is going to be much more important in order to reduce the social distancing. And then maybe treatments and then vaccine. How do you see the ability to get those out? Because you talk about equity, we could see a big challenge, right, in terms of vaccines only being available in the wealthy world early. And I know many people are working on that to try to change that. But how do you see the rollout of the health systems in these countries?
So for vaccine, if there is a vaccine, we hope that people who are financing it has an equity agenda behind it, and normally they have. Look at the last vaccine that has happened. Africa has access to that, HPV, etc. Now, if there is a new vaccine, I hope there will be this equity agenda. If not, we are not going to be able to compete. And we have to that's why global health education is key to leaders, to people who have the money, to people who are dictated what the world should do. And if we do that, it will be okay. But if they don't do that, don't expect that if the pandemic rebound or with mutation in Africa, that the Western world will be safe. The major lesson to take out of this outbreak, it's only through solidarity that humanity can make it.
You know the people personally in a lot of these big international institutions that are working on this. You're a senior advisor to Tedros at the WHO. You know the people at the World Bank, at USAID, at DFID. What is your message to them? What do you want to see them doing? I mean, there have been some announcements so far of initiatives, but it seems like we're still the early days in terms of how those institutions are going to respond.
Yeah, absolutely. And unfortunately, it takes time to build, to create a vaccine that's work. It takes time to do that. So, but also it takes the commitment to make it largely available the day it's work. And because nobody do that with their own money, people who have money like the Gates and the others are financing this. I hope that the finance go with accessibility. Normally it goes. So, and this, I think Tedros and other organizations today are willing to do that. The states in the world that doesn't have the human-centered agenda will be the most, where the people will be the most at risk, because the vulnerable in their state, even if they have money, those vulnerable doesn't have money, will not have access. That's why the notion of universal health care that we are fighting for, Tedros and others, is absolutely essential.
What is your view about the WHO controversy that's happening in the US? It seems like President Trump has decided that he wants to scapegoat WHO and Dr. Tedros, or at least he's decided that criticizing them seems to be a new part of the narrative. But, how do you view that?
It's okay, criticize so many people that it's just one of them. Second thing is that the world didn't follow him. Europe was the Africa, Europe, and the Middle East, etc., have committed and already give money to compensate the loss. It's for me a pity. And I know so many people in the US who doesn't follow it and try to reverse it. The only thing is that US is going to be out of the big debate of today and the big solution of today. And for a leader nation like that should not be.
Yeah, and how do you view, the kind of possible silver lining here, which is you're talking about how the health systems and universal health coverage should be a higher priority. Maybe coming out of this pandemic, you will see greater funding. On the other hand, you do have a nationalist streak happening in a lot of the world, including the United States. How do you see this evolving? One of the things that seems to be missing so far, I had Mark Dybel, who you know well, on a similar interview last week. And he was saying, why don't we have a costed proposal, $30 billion initiative for primary healthcare in Africa? Why don't we have these kind of big asks, these big initiatives? What's your view about that opportunity today?
So I just told you the biggest lesson learned out of this pandemic is that solidarity is the only way the humanity will make it today and for the next one. And also, the more the country around the world are strong and organized, the less the humanity will be in danger. So raising money to build primary healthcare across the world, it's okay, but also to build the system to deliver it in a sustainable way. Because you see, even the health sector in Rwanda is well organized. We have a lot of support coming from outside, but every year it's less and more coming from Rwandan budget and taxes as economy is developing. So we absolutely need it. If we have one country that is weak in the world, no country is safe in the world today. If we have one country that doesn't manage properly, because I have to tell you, the outbreak was predictable. An outbreak can be here, I told you, in the north. I told you where the forests are mismanaged, environment. Outbreaks are predictable. Pandemic are not. Pandemic is a failure of managing an outbreak. And a country can do that, we are all at risk. So let's all learn how to manage it and build the capacity everywhere, starting by a primary healthcare system and an organization in the country based on the global health principle, the 5S, meaning staff educated, system created, the equipment, the stuff. And also we need the space where to put people who are sick or at risk or contact or infected in a safe way, because if you put them in a place that will be mistreated, they will not come to you and you'll stay at risk. And the 5th S is the support to the vulnerable. If the vulnerable are not supported, they will not obey to your rules, and everything will go down and you'll have to use force, etc., and you create revolts.
I just want to mention, we've got people joining us from all over the world, from Nepal, Iran, India, Kenya, Senegal, Canada, the US, all over. And so if you have questions, those who are joining, feel free to put them into the chat. We'll try to get to anything that you put in. I do want to say that last S, Agnes, the support, really is the ethos behind Partners in Health, which is the international NGO that you're affiliated with, and that is a big proponent and backer behind the University for Global Health Equity. How is your university, which is so unique? I wrote about this a year ago when I went to visit. It's so unique. It's in the middle of nowhere in a way, right? In this beautiful countryside. And yet you're bringing people from all over the world there. You're focused on this issue of equity. How are you responding to social distancing as a university? How are you continuing your activities today?
So all schools are closed in Rwanda. We have asked special permission to keep the campus open because we have foreigners, as you say, coming from all over the world. We have more than 17 nationalities now on campus. We have asked all of them, do you want to go home or stay? This has to stay. So we have to open and apply social distancing inside the university. Each student has his own room. All classes are given online. There are ways to go to the restaurant. Everybody have to respect the 6 feet. And so to make sure that we start from A to, let's say, M, and from this time to go for breakfast, for lunch, for dinner, and the followers are coming just after. Everybody has 45 minutes to eat. And after that, we clean everything. Second wave is coming. Same for sport. You can go to the sport by only 2 by 2. And if you can walk around the campus, only respecting the distance. And it works well. They respect it. Washing hands before entering in every building, even the building with your room, sanitizer in each room, etc., etc. So we respect this, and to make sure also that the student, the staff, etc., leave the confinement properly. We have a health assessment every week with mental health assessment, and we have psychologists that are on standby in case they need counseling, etc. So this is how we live it, and the classes has continued e-based. We did that overnight because the first case was a Friday. Over the weekend, we say everybody back on campus, or tell us who want to go home, We give you a ride up to the airport to go home. We ask all parents, because we have parents of students who doesn't have, who are still minor, if they agree that we keep the kids, and we give them information every week. So this is how we live it, and it's not harder on campus than elsewhere, but it's a very safe little hub in the middle of nowhere. We told you that, and we went there by purpose because the majority of students are educated in cities, and after that you have somebody who have 26, 30 years and has them to go to work in rural area. No, they want to stay in cities where there are pub cinemas and they believe they can be happy, and that's not true. We want to show them that the majority of the time we are with them there, and that we can have a great life in rural areas, serving rural people and poor settings.
Now, one of the things when I visited that I know your university emphasized is virtual education. You've set up classrooms that have high bandwidth connections so you can have trainings from professors from all over the world. Now, a lot of people are saying that this pandemic is going to last for a long time. It's going to be months and months and months, maybe goes into well into next year, maybe 2 years, and that it's going to fundamentally change the way we all work. How do you see it changing the way we work? You know, your university is a global university. You work in an international sector where we all go to conferences and meetings. We travel so much more than we ever should probably as an industry when you think about global health and development. What do you think will be the permanent shifts that we see from all of this?
So the permanent shift, and I like people who have said, we have proved now that we can do even more work from home. And that's true. I hope that the world will use less plane, contributing less to the global warming. Something that you should investigate, Raj, is how many people was saved due to stop plane and using car, etc., etc. How many people have been saved? We may be very, very, very surprised on the numbers.
I'm sure many, especially you see the pictures from New Delhi and other places where the air is clean. It's like a miracle, right?
Yes, and from all those diseases, non-communicable diseases that asthma, heart, etc. How many people have been saved? So this is one. Second, we need also to understand that e-learning is an avenue to spread more education around the world. This is something that we should really understand. We have learned something due to the emergency. We are going to fine-tune it and to make our university more accessible to teach the principle of global health delivery across the world. So we will do more work out of this, making us accessible to more people around the world.
I know one of the issues that you work a lot on in Rwanda is the idea of nationalization or localization, right? This idea that we don't just need Europeans and Americans flying all over the world as experts. We can use professionals in the countries. Rwanda has been a leader on that. And so now there's a lot of talk that, well, you know, international expats, they're not going to be able to travel the way they used to. And so there's going to be no choice but to use more local organizations. How do you see that evolving? Do you think there's a potential there?
There is a lot of potential, and look, we have proven that we can do it. And also it's the first time there is a big failure in health management in the Western world, and great success out of the Western world. So this, I hope, will bring a little bit more cultural humility in the Western world and listen more to what the developing world can offer in helping, managing, and building health sectors that are human-centered. So I hope that the world will learn a lot. The exchange in a respectful and equal manner will be encouraged, because this is what we have also learned through this pandemic. Expertise is all over the world, not only in the Western world. Expertise can be shared without traveling. We have here the health leaders talking and exchanging and learning from each other with people in Asia and in Europe, without people say, okay, I'm coming and I will stay with you 3 days and I will do that, 3 days with you, 5 days of traveling, a lot of money and a lot of global warming. Now we can do all this. It's a time of exchange at lower cost. The people have say, with the use the world will do with internet, the system will collapse. We have proved it wrong. It's sometimes difficult to connect, yes. Sometimes you have problem, but you have achieved so much more sitting in your, I have achieved so much more sitting in my beautiful place here in Rwanda than I have done in all what I had planned before the shutdown. I remember I decided to come back to Rwanda. I was to take a plane to go to the US in a big conference, and I say, It was the 7th of March. I said, no, I'm going home. Things are going bad there. But what I have achieved with all my colleagues, my friends, my partners across the world from here has exactly the same value. And what you do now by interviewing us, sitting way in your kitchen, me in my terrace, the world will benefit in the same way as you have to take the plane and come and sit in a very nice studio. We have to change the way we live.
It's an important message, and you're right. And there's so much urgency at this moment that lets us change. I know we at Devex, we're all working from home around the world, 120 plus people, and yet we're producing more than ever. We've got a whole website and a page dedicated to the COVID response. We've got a timeline about everything happening in all the countries, including Rwanda. It's just been fantastic to see that, and the support of our community of 1 million health professionals, development professionals. I know we have to go, so I want to ask you one last thing, which is, what do you want to say to that community, to development and health professionals around the world who will see this? What's your message to them at this moment?
So my message is, first of all, pre-services. There are people who argue that we don't need the principle of global health or social justice in health education because we lose time. There was an article like that in the Washington Post. It's a shame, because if those people are not taught to social justice, they will not be there for the people in need. And if they are not there, outbreak will spread now like it spread in some countries. So we need this approach of global health principles, social justice in pre-services. Now in services, we need government, we need the people to invest enough money to protect the people who are saving them. Too many doctors. Do you understand that in Italy, they lost 200 doctors? I don't know if it's true. I didn't confront the number if it's true, but even less than that is a shame. They are there to save you and you don't give them the capacity. It's like sending soldiers to the front in front of a very sophisticated arm with nothing. It's a crime. So let's focus.
Community health workers might be in the same position, right? Community health workers in some countries are being sent out without anything, any kind of personal protective gear.
Absolutely. So don't send them out. Make them part of the system. If they found somebody in their village, have a call, and people educated and equipped are coming to help. Don't send people. People will not die. In any case, you destroy your own system. They will die. And those who are left will not take risk, and nobody take risk, you will die. So pre-service, social justice and principle of global health. In services, the world should protect them. And all this is the health sector that government and people who have the finance of the world should develop. And because for the next outbreak, if you are a nurse, are you going to risk to die for people who doesn't care of you? No. So let's all be together and take the major lesson. Only through solidarity, humanity will pass through such challenging time. And time to come, because this is just an alert.
Well, it's always wonderful to hear from you, Agnes Binagwaho, and thank you for such an important message and for sharing all of your thoughts all the way from Kigali. It's great to see you. Thank you
Thank
to
you.
everybody who's joined this conversation as well, and we'll keep it going here at Devex.
Bye, and thank you for having me.
Thank you. Bye-bye.
If there are questions, I'm ready to answer through Twitter.